exactly those young people that are in the criminal and justice systems and are already experience some use of drugs. So it's a very defined group of people. They are addressing a difficult environment, and I would add a varied environment, because the judicial systems, and especially the level of communication between judicial systems, health systems, and social works is very diverse across the European countries. And they address professionals. The fact that they address professionals makes these standards closer to the objectives of the sector I'm leading, because we really want to support practice. We really want to be close to professionals, to support them, to help them. Here, in the slide you don't see, I try to identify some challenges and opportunities going through each of the standards. Say something to me if I'm taking too much time. If I don't hear, I go on speaking. Okay.
You have 2.5 minutes.
Okay, I go on. So I was looking at standards 2, 4, 5, and 6. And I see that, for example, standard 2 talks about governing structures and processes. It's very good to introduce here the word governing, because it gives the clear idea that to implement these standards, you need to make speaking to each other systems that at least in some countries, works really in silos. That is the judicial system, especially with the health system. You mentioned structure and processes, and as I said here, you will find very different situations across the countries. In the standards 4, you say that the young people have to be helping their vulnerabilities, complex needs, and this needs to be at the center of interventions. This is really challenging the opportunities at the same time, because you are, I interpret, meaning that drug use is just one of the factors, and this probably not even the most important when you face someone that's so young, is already in a judicial system process. As well as in standard 5, you talk about a bundle of interventions. So you correctly did not even define the list of interventions, because this needs to be tailored to the individual cases, and you will surely find very different situations. And then in standard 6, there is the magic word continuity of care. It's something that we are repeating also for adults, and is apparently one of the most difficult things to achieve, although it's evident that the individual is one and cannot change according to the structure with which he or she is dealing. Looking at the intervention 1, at the standard 1, this is mentioning evidence-informed, which is very good, although I think that sometimes in the judicial system, evidence has a different meaning. So probably when later in some slides later, I will suggest training, you may need to stress this, at least for some of the practitioners you will deal with. And again, standard 3 about screening. I think it's very important that you stress that this has to be part of a comprehensive assessment. I can imagine countries where people is keen on providing screening for drugs to students. And if you think to some strange country, I'm referring to Italy, where they tried to implement screening of drugs in the school recently. So it's important to give a clear idea that this screening can be done just to support the young person in identification of potential problems, rather than just to create some additional problems, putting a blame on some behavior. And then, of course, standard 7 and 8 about young people participation and equity and non-discrimination. These are really universal and absolutely important standards. Of course, the interpretations may change hugely, but these are very, very important to have included here. Okay. And then 9 and 10 also open up to training of professional, because I guess in standard 9, when you say that practitioners demonstrate professional competence, you are referring to systems of lifelong training, and possibly also to systems of flexible training according to the problems they need to help to solve with the young people they work with. And of course, respect of ethical principle and professional code of practice. So I would say that overall, these standards open up to a very interesting set of interventions and tools that can be further developed, and that we would be keen on supporting in implementation. Okay. So some suggestions. I'm definitely concluding, just the last 2 slides. Some suggestions on my side. One is provide some experience-based training, work with the people, with the professional you are addressing, to see what type of training they can need to further implement these standards. Stress the importance of applying all the 10 standards. Avoid cherry picking, because as I said before, there are some, like standard 3, that could, if isolated, could be risky. Collect experiences of implementation. Would be very nice if you, through a website or I don't know, through some follow-up exercise, you ask those that are implementing these standards what were their experiences. And then, of course, evaluate this implementation by setting measurable context-specific objectives and measure their achievement. Here, young people opinion would be nice also to know how the young people that has been target of these standards consider this work. And then the last slide is a question for you, and is how can the MCDDA support the dissemination of these standards? So the easier thing we can do is to upload them in the best practice portal, but let us know what we can do. The last slide was a kind of a dramatic slide. I regret you cannot see, because this presentation was dedicated to the memory of Stefano Cucchi, who was probably not so young. He was 31 years old. He was killed by being beaten by police in a jail. And it was only because his sister went on for 10 years to try to find proofs that finally his killers were imprisoned themselves. And this picture was a very dramatic picture. So I just would like to say that it's so important, your project, because it can avoid this type of situations. Thank you.
Thank you very much. I'm feeling that you are staying with us during the session. I don't know. Anyway, I think we want to continue. Are you staying with us for the session?
Yes.
Okay, thank you very much. Harry Sandel. Harry is a professor in substance use at the Public Health Institute at Liverpool John Moore University.
Yeah, I'll have to be careful I don't press disconnect. Okay, so minimize and my presentation. That's birthday. Yeah, here we go. Okay, good morning everyone. As Jean-Paul mentioned, my name is Harry Sumnall, Professor of Substance Use at Public Health Institute.
Harry, you might use the microphone.
Yes, I need to press the button. Okay, so my name is Harry Sumnall. As Jean-Paul mentioned, that I'm a Professor of Substance Use at Liverpool John Moore University, so a lot of my research has been focused on drug education and prevention. For the last 10 or 15 years, probably one of the few members of one of the few groups who does drug prevention research in the UK, along with Middlesex, of course. So I led the team which developed the European Drug Prevention Quality Standards. Just want to acknowledge my colleague Angelina Brotherhood, who's currently at the University of Vienna, who works with me closely on this. And actually she did most of the hard work, and I just get to come to conferences and talk about it. But you know, science is a group exercise. So I was asked to provide just a few reflections and comments on the EPPIC quality standards and the EPPIC project, based upon some of the learnings that we gained from the EPPIC projects. This was a European funded project. We were funded over 7 years. We had big plans for future phases, but politics, EU, Brexit, etc. put paid to a lot of those plans. But I'm pleased to say that I think the value of EPPIC is that it came alive once other colleagues and once other teams actually took on these standards which we developed and began to develop them further into concrete and practical actions. So we have the EPPIC project, of course. We have training curriculums, the Universal Prevention Curriculum, a new project, the ASAP project, European projects. And to me, you know, even though I have some personal disappointment that I can no longer continue in this because of European funding restrictions, I think some really good work now taking place, which is taking EPPIC to the next level. And one of the strengths, I think, of EPPIC, and I was really pleased to see this yesterday, is about, there's a lot of reflection on what prevention actually means. What is the value behind prevention? How have we come up with this construction of this idea of prevention? Because I think that's something which we don't pay attention to. You know, why do we focus on particular outcomes? Why do we focus on restricting and changing behaviour in some populations? So I'm really glad that EPPIC did this. In EPPIC, we published a position paper on this, which subsequently informed the ACMD definition of prevention, and so it's good to see that we have some continuity there. Yeah, so this is just a highlight of some of those additional activities. And I think for EPPIC, the value has been not just around further adaptations and local use. So for example, in Sweden, there was a big 3 cities project around cannabis use, which was used EPPIC. In Poland, in Belgium, in Germany, there's been straightforward translations and adaptations. In the UK, a whole training and accreditation module was developed around this. But for me, the value of EPPIC, and probably EPPIC as well, is around developing consensus around what high quality prevention actually looks like. Because that seems really basic, but that's really important. Prevention in comparison to treatment and harm reduction is an area of work which has received scant attention over the last few years. There's lots of misunderstandings about what prevention can and cannot do. There's very few specialised prevention workers in many European countries. So I think the value of quality standards is developing that consensus. But the key thing for me about resources and projects such as EPPIC is how do we actually support practitioners and policy makers and decision makers to actually apply these quality standards in their day-to-day life. This is what we were hoping to do with future phases of EPPIC. And I think that's the real challenge for the EPPIC project as well. What is going to happen next? This just summarises that, but and it's good to see that you have addressed this in EPPIC, but quality standards will only ever be adopted by the people who count, and will only benefit ultimately target groups if the quality standards can offer solutions to those practical day-to-day problems faced by prevention professionals. And I think, you know, maybe it'll be worth spending a bit of time trying to understand what these barriers and what these challenges are, because many professionals, of course, want to improve their practice. Dedicated professionals, regardless of the field, are in a continuing cycle of self-development, professional development. Quality standards can help with that process, but only if they're introduced into a system and a context which recognises the day-to-day practical challenges that professionals face. I think that there's perhaps some bigger, maybe some more fundamental, maybe some more abstract and philosophical challenges as well that the project leads might need to think about. That, to be honest, across Europe, prevention is really weak. I obviously know a bit more about the UK. In the UK, we don't have a prevention system. We have a barely functioning prevention system. We don't have funding and resource for prevention. We have very little prevention activity. Now, that is not to discount the really good work which takes place in services, but I think the vision and model of prevention which is presented in EDPQS and EPPIC is very, very different, in my view, from what's taking place on the ground. So that sort of system and that sort of model, we need to do some work to develop that first of all. And another point as well, that the EPPIC quality standards, in keeping with the EDPQS quality standards, very much focused on what services and projects do, to improve development of programs and ways of working. But those sorts of activities are just one object within a wider prevention system, a wider ecosystem of prevention, which may be better or more weakly developed in different countries. And actually this is a big challenge because I used to have quite a straightforward view about what prevention actually is. And in keeping with the ACMD definition that EPPIC uses, that prevention was about prevention of harmful drug use. That makes sense. But actually my view of prevention has actually developed a bit further now, and I kind of see prevention almost as a harm reduction mechanism to reduce the harms of poor public health and social policy. So actually a lot of prevention is responding to the gaps in national policy. We're trying to prevent drug use, for example, and the harms from drug use, because national health and social policies are creating the conditions where drug use and harmful drug use is much more likely. And taking that expanded position, it's actually, well, what impact can projects, programs and services actually have, because it's very difficult to influence through those activities national policy systems and the policy environment. But that's slightly pessimistic. That's just how I'm feeling on this Friday morning. Some of the realities that certainly what we found with EDPQS, and I suspect the same might be true with EPPIC, that quality standards tend to be aspirational. We, as part of the development of EDPQS, we did a lot of close work with a number of different projects, and subsequently in other European funded work, colleagues have also assessed projects and services against quality standards. And very few projects in reality actually meet quality standards, even basic level of quality standards. So a lot of the work that we're doing is aspirational. And therefore, what is the support that we're offering to services and program providers to reach those aspirations? Now, that can't be done through a printed manual or leaflet or whatever. We found that very quickly with the EDPQS. It's what support and structures are going to be put in place to help people develop their practice around this. And I think we found it very useful that when we think about interventions, and Hannah yesterday was, I think, illustrated this very nicely, we need to spend time trying to understand how interventions, prevention interventions actually work. Well, I think for EPPIC, as well as other quality standards, we need to develop theories of change and mechanisms about how we think quality standards will also lead to practice change or policy change, or whatever area of work that you're focused on. So we did this with EDPQS. If you're interested in reading it in detail, then the information is on our website and I can send you the details. But actually, this is, the production of quality standards is an intervention in itself, or an intervention object in itself. So this is a different way about thinking of quality standards. Yes, it's aspirational, but it's also a tool to help people move towards those aspirations. And we think there's some, some quite fundamental and basic activities that need to be considered to be taken into account before we can support people with the uptake of quality standards. There needs to be, this is really obvious maybe, but it's worth saying, we need good awareness of the funding and political environment. This is important for the UK context, for example. I'm sure it's true in other countries. So the EPPIC, the European Quality Standards, are a central component of the 2017 UK drug strategy. I was really pleased to see that. Universities love that sort of thing. But actually, there's absolutely no resource to help people working in the field implement those quality standards, which are part of the central pillar of our country's prevention approaches. So we need to be really aware of this. And I think in those countries in Europe which have had a lot more success with the implementation of quality standards, thinking of Croatia, for example, and Poland on a regional level, there's actually been that political, regional and central commitment to actually fund, to give those incentives for projects and services to implement quality standards. The reality is, those day-to-day realities, why should services adopt these approaches if they're not going to be rewarded? Individual level professionals want to be aspirational, they want to do improve their quality of work, but for services, what is the intervention? It's also really important to have charismatic leaders and orators. In those countries where EPPIC has been particularly successful, particularly with regards to uptake into policy, it's been championed. And we've worked closely in a number of countries with what we called EPPIC champions. And this is the same for all advocacy activities, evidence-based policy change, community champions. So in the EPPIC project, who are your champions? Who are going to champion this? Who has the eyes and ears of government? Who can really make that case? It's certainly not academics. We might be good at talking to conferences, but we're not good at talking to policymakers and communities and practitioners. So think about who's going to be involved in this. And also think about, as part of the development of services, how are these quality standards going to support change? And there's some good literature around this about organisational change, particularly from the implementation science field. And actually I think it's really important, if the EPPIC project is going to continue, maybe to develop it into an action research project as well. To really work closely with a number of services, a number of case studies, working with those over several months or a year to help them embed and evaluate, test and refine in the classic action research cycle the implementation and utility of quality standards. And this is one of the ambitions that we had with EPPIC, but unfortunately we couldn't fulfill. Very aware of time, so I'll just finish here. So Leslie, I was really glad, I think it was Rachel who mentioned this yesterday, and she was talking about some of the issues and concerns around adaptation and transferability. And she spoke about hierarchies and prominence of different professions. And I think there's probably a lack of understanding across different sectors around prevention cultures. What does prevention actually mean, and how is it valued between different sectors and professional organisations? What does prevention actually mean? What utility does prevention has, for example, within police compared to a social worker or a health worker? And I think it was last year or maybe the year before that, Drugs Education, Prevention and Policy, the journal, had a special issue partly dedicated to this. I've written a chapter about this. But I think that that's really important because, of course, professionals working within the system have to be able to integrate the values in your quality standards into their own understanding and day-to-day work. So I think you need to explore in a bit more detail what are these professional cultures. Okay, so there's some of my reflections. I'm really pleased that these quality standards have been produced. I think it's going to be a really valuable, useful piece of work. I'm glad to see that there's so many enthusiastic people working in this area. Thanks.
I'd like to move on to Raju B. Raju is the head of operations of children and young people services at CJL, Change, Grow, Live in the UK, as you know, most of you. And that's a rather large organization, as I understand, with some 27,000 clients. So I'm very interested to hear from Rai his perspective, and especially on how an organization like CGL could work with those standards, for example. Thank you.
Yeah, thanks, Jean-Paul. Good morning. So as Jean-Paul said, my name is Raju B, and I oversee Children Young People Services for a national charity called Change Grow Live. I think this topic is particularly relevant to me because there's practical implications in terms of how we implement these quality standards within our organisation. It's something that we've got experience of doing, and it's some of the learning that I wanted to share with you all today in terms of how we can meaningfully secure workforce engagement. So I feel as though I need to do a brief disclaimer. I think amongst all of the quite eclectic European accents that we've had over the last 2 days, this quite harsh brass Yorkshire accent is likely to be a bit sobering. So if you struggle to understand me, and I know people have struggled to understand the northern accent, then just ask me to slow down or repeat myself. But I am conscious that John Paul's been very strict with time, so I'll have to strike a balance between understanding and getting through the presentation. So my whole presentation, in all honesty, is pinned on a caption from the quality standards themselves, and I've based it on this. I think it's in one of the concluding remarks. There was knowledge about quality standards and experience of using quality standards is not widely found amongst practitioners. If the standards are to make a contribution to the development and effective implementation of interventions, efforts are needed to raise awareness amongst practitioners and provide accessible knowledge, tools and possibly training to facilitate uptake. So what we've got here and what we've heard over the last 2 days is a quite remarkable project with some great outcomes, and actually at the end of it a quite nice shiny product as well. There's a hell of a lot of rich data. We've got perspectives from young people, from practitioners, from existing evidence and guidelines. And actually I think it's one of those instances where I think the process genuinely has brought integrity to the outcome in terms of what we've produced. But there's a but and a very big but really, in that actually there may be some risk often of having this quite premature pat on the back and a congratulations before we've actually embedded and implemented those standards in a meaningful way. So the job's only half being done, and the true success, I feel, of the quality standards is almost wholly determined by the level of engagement we get from our frontline workforce. So regardless of the change that we have at a policy level or an organisational level, ultimately the delivery agents for this work that can make a difference are going to be our frontline practitioners. So that's something that I want to talk to you a little bit about today. And there's two perspectives that I want to focus on in this very brief presentation, and one of those is some rapid consultation that I did with frontline practitioners who I showed these quality standards. Now those practitioners that work for Change Grow Live both operate within a youth justice system, but there are others who also operate within a community setting, offering support to young people that are drug experienced and have got contact with the youth justice system. And secondly, whilst we've been undergoing this process, organisationally within Change Grow Live, we've been undergoing a similar journey whereby we've been trying to introduce some quality standards, all of which are underpinned by national and European guidelines. And there's some real learning to be taken from it. In all transparency, there's been some huge mistakes that we've made organisationally, but some really valuable learning that I think it's worthwhile sharing. So I think the first most important thing to acknowledge, and this was raised a couple of times yesterday, is what do the quality standards mean for us in practice? And I think we need to be really, really clear on what value these quality standards can bring in practice when planning and thinking about how we implement. Now, here are some of the key reflections from some of those practitioners having seen the quality standards. So the first one was it provides a helpful benchmark for quality practice, and by that they meant it was one that was informed by peers, young people themselves, as well as existing research and evidence across Europe. And there's a particular reference to new or inexperienced staff, and I think Ari's completely right that actually a lot of staff, even those that are more experienced, are seeking professional development and constantly seeking to improve their practice, particularly in relation to prevention, where there's probably a bit of a gap and a space in terms of some clarity around best practice. But it was, one of the things that we see organisationally is that actually new or inexperienced staff are the ones that actively seek out these types of quality guidelines and are likely to engage with those increasingly. But even with those staff that are more experienced, it consolidates and it reaffirms purposeful practice. And it provides a reflection framework on multiple levels, on an individual level, so on a one-to-one basis. You can use the quality standards in reflective practice or in one-to-one supervisions. You can do those at a group or a team level, at an organisational level, and externally it can consolidate or reaffirm good practice at a partnership or a commissioning level as well. And I've been deliberate in my choice of words in using purposeful practice, because I think use of language is really important when we're considering quality standards and guidelines. And one of the learning that the key bits of learning we've had organisationally is to avoid use of quite binary terms like good practice or bad practice, because staff are disengaging at the outset in something that they feel may be responded to with a sense of blame or judgment. So I think use of language is important. The next one is enabling practitioners to have a shared approach on what makes a difference to children and young people from this particular target audience. And that can go internally from one worker to another worker, where they've got a common purpose or a shared purpose and a shared value. It provides continuity of care, where quite often you see young people that need to transfer from one worker to another for various reasons. But I think more importantly, it provides this sense of shared approach across partnerships. And we heard yesterday around the possible conflict between the offender management model of engagement and possibly the CYP, or the children and young people first model, that's more prevalent within the community. And one of the things that we heard from practitioners is that this provides a really helpful reference point in negotiating some of that intersectoral collaboration. And one of the things that we have with all of our youth offending services organisationally is a service level agreement. It's a document which outlines what some of the key expectations are in that particular relationship. And quite often it's not had a particular set of quite credible guidelines which would underpin such a central document. This obviously helps provide that. The next one was quite interesting, and it was one which was exclusively voiced from our community health practitioners. It was that it gives your approach integrity. And as I said, it was those staff from a community setting, particularly those that were representing the third sector. They acknowledged this hierarchy where they felt the more submissive of the two partners in a partnership with youth justice colleagues. And this again provided a credible reference point which supports your work, and I thought that was extremely useful. The next one's relatively straightforward and an obvious one. We get regular calls from our workforce to provide up-to-date, meaningful training and learning development opportunities for our staff. But quite often we want it to be underpinned by something which carries a great deal of evidence and research, and this provides that. So this provides a framework for which we can start to develop training and workforce development. And lastly, turning policy into practice. It's a really, really simple one, but these guidelines represent the vehicle through which we can start to translate some of the policy, some of the evidence, some of the research into practice and really make a difference. And I think that's ultimately something that we need to keep at the forefront of our minds. Equally important is trying to acknowledge some of the challenges that you might come across when you're trying to introduce these types of quality standards to frontline staff. Now, whilst we had many staff that I spoke to that were curious and supportive of quite helpful standards and guidelines, the most common reservation and misconception from staff, even prior to having seen the quality standards themselves, was that they would impair their ability to apply a creative flair to their work. And it was something that they held quite dearly in terms of their role and their purpose for coming into this line of work, and they felt that actually there was an opportunity for these things to stifle innovation. There was one particular quote that I had from one of the practitioners, and it was, "Standards mean consistency, which means you want us all to do the same thing." And that really isn't the case. I mean, it is a misconception, and in fact the opposite is to be said of these standards. They provide a foundation, they provide some clear parameters, and they offer the what's, and they offer practitioners the license and the autonomy to be able to identify the how's, which is where they can apply some of that creative flair. Confusion was one that came up multiple times amongst practitioners. It's something that we've seen organisationally, and that staff reported an information overload and having difficulties in navigating across all the multiple different frameworks. I think the one thing to be said around this one is there are clear issues where there's overlap between different standards, guidelines, regulatory frameworks, but it's even more of an issue where they're in conflict with each other, and those need to be addressed before you roll those out to staff to avoid that confusion. And there's obviously there'll be equivalent frameworks in our European partner countries, but organisations, some of the ones that we've embedded within our internal quality standards are CQC, NICE guidelines, Ofsted, the EPPIC guidelines, and the practice standards developed by the Royal College of Psychiatrists as well. So there's a hell of a lot of information to be able to synthesise and streamline and get into a set of quality standards that appear coherent to frontline staff. The next one was, do the guidelines need guidance in themselves? And I think this one's quite key when we're talking about frontline staff, because a lot of the staff who'd read them said, actually these standards are interesting, they're agreeable, and in some sense actually the common sense completely resonate with everything that's being said. But they felt that they themselves needed guidance, and service leaders needed some guidance on how they are embedded to remain a part of their working practice on a day-to-day basis. I think something that we've seen organisationally is that when standards like these are introduced, there's this initial enthusiasm and engagement with those standards, but where you haven't thought about the appropriate systems and processes to introduce those, that actually some of that change and some of that learning isn't sustainable. And actually what you might find is we've got a project whereby we've spent 3 years doing a hell of a lot of good work, and in 6 months' time they're gathering dust on the shelf, which is something that we absolutely don't want. The next one is crucial. So do the quality standards simply represent an audit checklist or a tick box exercise for a primary focus on compliance? That was one of the things that we heard from staff. And we've had some learning from this organisation, and I can speak with some degree of transparency, in that we had a quality improvement toolkit that we had several years ago before I came to the organisation, and it appeared quite audit and compliance orientated, and what we ended up with was this this purpose that had been lost, with staff that became quite fearful and target driven unnecessarily, in all honesty. And more recently what we've done is introduce an integrated audit cycle where there's much more of an emphasis on speaking about what underpins the standards, what their purpose is, and the conditions for learning and evaluation, so around openness, learning and opportunities. Capacity building. I mean, it goes without saying that we're in a climate where we're all being expected to do more for less, and actually what we're doing here is there's very little brain space for staff who are working with very high caseloads, seeing young people back to back every day, for us to give them something else to synthesise and implement within their working practice. So in order for them to give it the time that it deserves, they need to be able to see the value in it. So I'll refer back to the previous slide and ensuring that actually when you implement, it's absolutely crucial that staff see the value and how it will make a difference. Next one is interventions versus relationships. I mean, the EPPIC project and some of the learning in itself has shone a light on just the importance of relationships in terms of engaging young people that are drug and alcohol experienced and involved in the criminal justice system. But these guidelines exclusively speak about interventions and the quality around interventions, and there's this sense from staff that actually, having read the guidelines, there was this prevailing sense that there's a great importance placed on the intervention as opposed to the relationships. I think when we're introducing some of the quality standards, it's going to be helpful to provide a balanced perspective on actually what does make a difference to young people who are facing these issues. And the next one is more of a question: how do future-proof standards fit for 2020? So it's a cycle of continued learning and feeding back and hopefully updating. So John Paul's giving me the eye, so I'll try to flick through some of these recommendations fairly quickly. Co-production is the first one, and I think this one's key, so we need to, I alluded to it in my last slide, we need to get practitioners to see the value of the quality standards through the perspective of service users and not through the perspective of the organisation. It needs to feel as though it's serving a purpose genuinely for services, as for service users, before it's serving a purpose for the organisation, for policymakers or for systems and processes. I think that's absolutely key. One of the things that's worked particularly well, and I acknowledge the challenges given some of the things we spoke about yesterday around peer mentoring, is having young people who've been involved throughout this process, is why not extend their involvement in the introduction, implementation and evaluation of the standards themselves. So one of the things that we do at Change Grow Live is have young people roll out the standards to frontline staff so they see them through that perspective, but they also come back in and they audit our services themselves based on their standards, and they come to team meetings and feed that back. I think it really carries much more powerful meaning. Integrate the standards, I alluded to this, so provide clarity, not confusion, and streamline the process, and where there is conflict between different standards, frameworks and guidelines, is clear that up before you roll it out to staff. This needs a collaborative whole systems approach, and how do we promote that across partnerships? I think that one's going to be absolutely key. There's very little point in health professionals or community professionals adopting these standards and that not being replicated within a youth justice setting. And I think we need to take an active role and a responsibility to try to promote these in a coordinated way. And actually the complexity increases when you're trying to implement these from a micro level or an individual level through to a team level, an organisational level, and ultimately at a partnership level the complexity increases. So we need to think about different approaches about how we introduce it from a micro level upwards. Choose and test your approach. Now this one's absolutely key, and we need to think about where, how and why we'll implement these quality standards. And there's various ways in which you can do it. I mean, are you going to create some kind of helpful audit whereby you can assess the degree to which you're operating in line with purposeful practice? Are you going to develop some training? Are you going to develop helpful resources for frontline practitioners which help inform resources? Are we going to include it in our recruitment procedures? So do we start including some of this stuff within our job descriptions? Do we ask questions about it in our interview panels? How do we include it in our organisational policies, our procedures, and how does it inform our service level agreements or partnership agreements with partners in youth justice services equally? So we need to think about what our approach is going to be to implement it. Simply asking staff to digest it and think of their own way is likely to be insufficient. Get clarity on the what's and invest your time in the hows, I think is absolutely crucial. So being told what to do is less engaging than being given a license to find out how to do it. I think that's exactly what the quality standards do. They simply tell us what to do. They provide a foundation, some helpful parameters. What they don't do is provide the hows, the specifics. I think that's the thing which really engages frontline practitioners. And finally, most importantly, create the conditions for a learning and evaluation culture. None of this can be done until you address your culture around how staff perceive learning and evaluation. So there's a couple of tips that I've got. Keep the focus on people rather than on systems and processes. Focus on the purpose and the values over the performance or the outcomes. Develop a learning culture which promotes psychological safety for staff, where practitioners can say we don't currently do that and feel safe to say that without feeling this sense of blame or judgment. And ultimately, organisational approaches to empowering staff will ultimately be mirrored in staff approaches or workforce approaches in terms of how they empower their service users as well. So I think it's important that we acknowledge that. And I think it's been mentioned in the two preceding presentation, but evaluation is key. So I think what we need to be doing is carefully selecting our implementation methods, evaluating those, learning from those and feeding that back across those partnerships. So I think it'll be really helpful to maintain this knowledge exchange as we move through introduction, implementation and evaluation as well. So there's a lot to get in. I spoke very fast. I hope you understood